Hey guys, just a disclaimer before I start the episode. In this episode, I'm talking about my experience with brain surgery in the medical field and all that stuff. And I just want to emphasize again, which I will do in the episode, that it is very important to follow the instructions of a medical professional. I am not a medical professional. I am just someone who has had an experience, and I am sharing that experience for anyone who may be having a similar experience or have had a similar experience. But again, I am not a medical professional. I have no medical experience whatsoever. So always, consult with a professional for your medical needs. And again, I'm just sharing my experience, and I do think it's important to advocate for yourself, but it's also important to do what's best for your health and all that good stuff. So just as a disclaimer, everything that I say in the episode is how I truly feel, but I am not someone who is giving medical advice because I am not licensed or authorized to do so. So enjoy this episode, and thanks for listening. Hello, and welcome to another episode of Healing with Nama. I am Casey, aka Nama, and I am back with another solo episode. I also wanted to just say thank you so much to everyone who continues to listen to the podcast. The last episode that I did with Meg on Twin Flames has been doing amazing, and people are seeming to really love that episode. Hopefully her and I can get our schedules together and meet to do another episode, because it's something that I really enjoy learning about and talking about, and obviously other people do too. So I definitely plan on having her back on the show again in the near future to talk about Twin Flame Union. And I'd also love for anyone that was really interested in that episode to let me know if you have any specific questions, like about Union, or anything that you would want me to ask her about when we do the episode. You can just, put that on Instagram or like DM me or something, so that I can make sure that I get those questions and ask her the questions that you guys want to know about. And yeah, so look forward to that episode eventually. I'm not sure when we'll be able to get that together, but hopefully sooner rather than later. All right. And yeah, so let's just jump into this episode. This episode, I just wanted to talk about something that happened, excuse me, with me, or to me, or for me, I guess, a couple of years ago. If you follow me on YouTube, you already probably heard this story, maybe, if you've listened to the episodes, but it is my brain surgery. So for those who don't know, in May of 2020, I underwent, is that a word? I don't know. I had brain surgery to remove a tumor from my pituitary gland. And on YouTube, I did a 3-part episode just talking about the experience and stuff. But I figured it would be good to make a podcast episode about it, just because some of my listeners may have not heard that story. And I also think it's really important because it's a situation where I did have to advocate for myself and my health, and be persistent, and not just, take what the doctors were saying as the only way out, because I knew that something was wrong. And I just think it's really important to make sure that people understand that while doctors, medical professionals are professionals, and they are well versed in their profession, it's important to know when something is going on with your body and people are not listening, because there are instances, not every time, but there are instances where people are advocating for themselves, or they're telling their doctor, hey, this is how I'm feeling, this is what's happening, and they're not getting help, and the doctor is just kind of telling them, just, oh, take this medicine, do this, do that, and it's not helping. And people are having these conditions, or things are happening that shouldn't be happening, because if the doctor just would listen to them and do more than just throwing prescriptions at them, the problem could be solved a lot quicker. So that's just a long way of saying it's important to know when it's okay to advocate for yourself, especially when it comes to your medical health. There's a lot of high birth rate, deaths at childbirth for women, especially African American women, because nobody's listening to them when they're saying, hey, something's not right, or there's just so many things that can happen. And while I appreciate all the medical professionals out there, and the healthcare people and the frontliners, there are instances where people are not being heard, and it's just really important for you to know that it's okay to speak up for yourself. So anyway, after all that blah blah blah, I just wanted to kind of tell you about my story. So hopefully I can fit everything into one episode, but I do not like making super duper long episodes, just because I personally don't have a long attention span, and I don't like hearing long stories. So sometimes it's easier for me just to break things up, because it gives me a little bit of a break and like a pause, and I can kind of like regroup so that I can pay attention really and absorb what's being said. So I'll just start from as far at the beginning as I can remember. So I had an irregular menstrual cycle for years. And I remember vaguely going to like the nurse at my college and telling her what was happening. She's like, oh, that's normal, not a big deal, whatever. So for years, I just had an irregular period and didn't think anything of it. And I figured, this is normal because this person is telling me that it's normal. So it's nothing for me to really worry about. And as I got older, and my sister was diagnosed with polycystic ovarian syndrome, or ovary syndrome, she was telling me the symptoms that she was having, and I'm like, that sounds a lot like what's happening with me and what's been happening to me for such a long time. I think I need to look into that. So I did. I went to my PCP, my primary care physician, and told her, hey, this is what I'm experiencing. I having irregular periods and hair growth and acne and all these different things. And my sister has just been diagnosed with PCOS, and I think that I might also have it as well. And she did some tests, she did the whatever it is for my ovaries to see if there were any cysts, and there weren't. So she's like, well, I don't think you have PCOS and all this other stuff. And I'm like, okay, but something's wrong. Obviously I'm not supposed to be having irregular cycles and all this other stuff, and I really would like you to refer me to someone who is a specialist in this and who can actually give me more information about this PCOS, because I don't feel like it's okay for this to be happening to me. So I had to ask her a couple of times to refer me, and she did refer me to an endocrinologist, and that's a hormone doctor. And then I saw that hormone doctor, and she listened to what I was telling her, diagnosed me with PCOS, and told me to take certain medications. She basically told me there's no cure, there's nothing you can do. All you can do is take these medications to kind of stop the hair growth, stop you from being pre-diabetic, and try and regulate your cycle. So at first I was hesitant. I didn't want to take all those medications. I didn't really want to start on birth control and all those things. So it took me a little bit of time to actually say, okay, I want to start taking these things. It took me a few months. And then finally I was like, okay, I think it's a good idea, because, I was thinking about the future. At this point, I think I was 26 or going on 27. And I was thinking about, the future, I want to have kids, blah, blah, blah. So I went back and I said, okay, I'll start taking the medication. So I started taking birth control and metformin and spironolactone, which is to stop the, like, supposed to stop the hair growth and like help with your hormones, because from my understanding, PCOS also affects your hormone levels. So women with PCOS have higher levels of testosterone, which is why you would see the extra hair growth, on your chin or wherever. And some women have it really, really prominent to where it's very obvious that they have like masculine hair growth. I don't know how to say it in a way that's not rude or anything like that, but they have a lot of excess hair growth. And luckily in my case it wasn't that, but it was more than what I would like it to have been. So anyway, after about a year and a half of taking all those medications, and still I did not have regular cycles. My cycle was still irregular. The hair growth was still there. The acne was still there. Nothing really changed. The only thing that really helped with the acne, because at the time I had cystic acne, which is like super painful. It was itchy. It was very prominent, like especially along my jawline. It was just really inflamed and just awful. It was embarrassing for me. I didn't want to be seen without makeup because my face just looked, just had pimples all the time. Sometimes they were white. Like, it just looked really bad. And I was taking all these medicines and nothing was helping. The only thing that helped with the acne was taking turmeric capsules. And that, I noticed, kind of like took down the inflammation in my body and helped the acne not be so awful. And so I heard this doctor on a podcast named Jolene Brighton, and she was, an endocrinologist, and she had written a book called Beyond the Pill, and it was talking about all the things that can happen when you take birth control. And it just had a lot of helpful information about, how your body reacts to birth control and why it's not really that great for you. Different things that you can do. Like, it just had so much information in it. And I had already really been thinking about no longer taking those medications because they weren't working. So to me, it was like, what's the point? They're not working. I don't have regular periods. The hair is still there. Like, everything's the same. And after I read that book, I was like, I don't want to take this anymore, because not only is nothing changing, but now I'm putting this stuff in my body, and it can have long-term effects, and there's just no point. There's no point in me taking all of these things and they're not working, and they're doing more harm than good. So I stopped taking all the medicines. I did do it cold turkey. I didn't talk to my doctor about it. I don't recommend that. Always talk to your medical professional, your doctor, before you do that. But I don't think that I did that. I don't remember. It's been a few years, but I don't remember actually talking to them. I just said, I'm not taking this anymore, and I didn't take it anymore. I didn't notice any side effects, but again, talk to your doctor before you stop any medications that you've been put on, because that's really important. And then along the lines of me stopping the medication, I had a switch in insurance. So I lost, the doctors that I was going to before. I had to get new doctors, which meant getting a new endocrinologist as well. And he is actually someone that I consider like a savior, because he changed my life. So Dr. Joe, he was the endocrinologist that I was assigned to for my new insurance. I went to go see him. I told him my history about, having the PCOS and the symptoms and having taken this medication, but it didn't work. And he's like, yeah, if it's not working, go ahead and stop. You don't need to be taking this medication for no reason. And I was like, well, that's good, because I'm not taking it anyway. So, he agreed with me about the birth control and all those things. And I told him at the time, before I had, saw him, I was talking to my primary care physician, and I was saying, hey, I want to have the gastric sleeve, because I know other people who have had the gastric sleeve because of their weight, and At this time, I was pushing 200 pounds, and I'm only 5'2", so it was very uncomfortable for me. I felt bloated, uncomfortable. My face had gotten very round. I couldn't fit my clothes anymore. I was tired and sluggish. Like, I just felt awful, and I was like, I'm exercising 5 days a week. I'm doing high intensity workouts. I'm walking. I'm trying to eat better, and I'm actually gaining weight rather than losing weight. And this had been going on for almost a year, and I was like, okay, well, then I'm gonna get this gastric sleeve. Everybody else, around me had gotten it and had lost weight, and I'm like, I'm just gonna get this gastric sleeve because I cannot continue to gain weight. This is not fun for me. And so I had already talked to my primary care physician about starting the process. What do I need to do? Like, let's get this gastric sleeve thing going. And then I went to go see this new endocrinologist, and he's like, I feel like you should wait. I want you to wait because there's another option. There's something else that could be happening with what the symptoms that you're describing, and I don't want you to have an unnecessary weight loss surgery. So he's like, let's do these tests. Let's run these tests, these urine tests and all these different tests, because I think that you might have Cushing's disease. I had no idea what that was, but he explained it to me, and how I understand it to be is your body is overproducing the stress hormone, which is cortisol. And so it's kind of like that fight or flight response in your body is overproducing. It's overworking, and it's on all the time, and it's on like 100%. Just going, and that is not good for your body. It does a lot of damage to your body because you're not supposed to be in that state all day, every day. That's only a response that you're supposed to be having, that your body's supposed to be having when you're actually in distress or there's something actually wrong. So to go about your daily life and your body is constantly in that state, it can affect your body, and it can affect the way that your body works, which caused me to gain weight, which caused me to have irregular periods and everything else, all those different things. So he wanted me to do these tests and see if my cortisol levels were high. They were like sky high. When they came back, the cortisol levels were super high. And so he's like, okay, definitely something's going on. Now we need to figure out where the cortisol is coming from. I guess like the levels, when you have Cushing's, it can either be coming from your adrenal gland or it could be coming from your pituitary gland, which is on your brain. And he's like, we need to do a brain MRI because from the looks of the test that we've already run, it looks like to me that your Cushing's is coming from your pituitary gland. So we need to do an MRI in your brain to make sure, to see if there's actually a tumor or not, so we can move forward. So I'm like, okay. And I was very distraught. I was not expecting to hear that. Definitely. I went to that doctor's appointment by myself because, I just didn't realize what was happening. I didn't think that I was going to hear that when I went to go and see him. And he told me the possibilities of what could happen if the brain tumor was there, if it was coming from my brain, was either radiology or radiation or brain surgery. And I'm like, neither one of those options sound good at all. I was not prepared to hear that I might have to have either radiation or brain surgery. Like, neither option sounds good, and I'm freaking out. I was crying. I was upset. I had to, tell my family what was happening, and of course they're, worried because neither option sounds good. And it just wasn't good. And then obviously a lot of people, when you hear tumor, you think cancer. And my maternal grandmother passed away from lung cancer. So it's just very sore subject for all of us to hear tumor, So it was very worrisome. And all I could do was pray and just, ask God to protect me and make sure that whatever outcome it would be the best outcome. And it wouldn't be cancer, it would be benign, everything would be okay, because I was really scared. So I had to go in to get the MRI a little bit later, and it did come back that I had a tumor on my brain. They told me it was benign, so that was a relief. It wasn't very big, but it was big enough to be causing a problem because the pituitary gland isn't that big. So anything that's kind of just laying on that gland is an issue. So luckily, it wasn't in a place where it was affecting my eyesight. Like, there's so many things that can happen by having this tumor on your brain. And I thank God every day that it was found before, any real damage could have been done, because it could have been much worse than it was. And so I'm so thankful that I didn't give up. I didn't say, oh, well, I have PCOS. I'm just going to keep taking these medicines forever, even though they're not working. Or after I lost my other insurance, I just was like, oh, I didn't just say, oh, I'm not going to go back to endocrinologist. I was like, no, there's still an issue. I need to see an endocrinologist, and I need somebody to fix this because there is a problem. I'm not losing weight. I'm exercising. I'm gaining. Like, something is wrong. So that's why I said it's so important for you to advocate for yourself. If you know your body, if something isn't right, that, if there's something going on and you feel like the medicine that you're taking isn't working or it's making things worse, I am 100% a believer that it is okay for you to tell your doctor that, you need help. I need you to, if you can't help me, I need you to direct me to the specialist that can. I need a second opinion. I need you to put this down, on my chart and say that you are refusing to run these tests for me. Like, it is very important, and it may be controversial to say this, but it is important to me as someone who's gone through it and gone through having to push for people to listen to me, to get people to understand that it is important to speak up for yourself. Your doctor is not the end all be all. Yes, they have a medical degree, but you know what your body is doing or not doing. And if something doesn't feel right, you have every right to advocate for yourself. So that's my little PSA. So that's what I did. I did that for myself, and I'm still to this day very proud of myself for doing that. And this was at the end of 2019. All this was happening, and I'm very proud of myself still, because things could be a lot different for me in my life if I hadn't done that. And thank God that I did. So having that MRI come back, and then having to move forward with finding another doctor, a neurosurgeon, to perform the surgery and to speak with me about, what could happen, what does the surgery look like, give me all the rundown about all these different things, was really helpful, because I didn't know I had no idea what this was. So just imagine, going through all of this, and I don't know anybody who's had Cushing's. I've never even heard of that. So I didn't know anything about it. So I'm really thankful that for the most part, all the doctors that I talked to from the point where I found out that I had Cushing's on were very helpful and made me feel good. They made me feel like this is something that is still kind of new, but that there are people out there that know about this, and they know what to do, and they know how to work with it, and you're in good hands. And that made me feel really good. So after I got the MRI and talked to the doctor, realized that neurosurgeon in particular wasn't going to be able to do the surgery, because the surgery that I needed is a pituitary tumor removal surgery. There's a medical term for it. I don't know how to pronounce it, so I'm not even going to try. But in that case, there has to be a neurosurgeon, obviously, to work on the brain, but there also needs to be an ENT, an ear, nose, and throat doctor, because this surgery requires them to go up through your nose. So by the grace of God, I didn't have to have, a hole in my head, or, I didn't have to have them cut through my head. They could go up through my nose. It's called endoscopic, endonasal. Go up through my nose to reach the space on my brain where the pituitary gland was, scrape the tumor out. So the first neurosurgeon that I went to go see could not find an ENT that would be able to work with him, and took my insurance. So he referred me out And he advocated for me for my insurance company, and fought with them because they didn't want to have me go somewhere out of network. But he's like, I cannot perform this surgery. You need to send her to this place. And that place was UC Irvine. So up in Irvine, which at the time was about an hour and a half away from me. And I didn't want to have to go there because it was an hour and a half away. It was inconvenient. There was another place that was a little bit closer, but my insurance was being difficult, so I ended up at UCI. And the doctor that I had seen, the neurosurgeon that I had seen previously, knew those people up at UCI. He knew the doctor, so he was able to refer me, and he was able to let me know, like, these are doctors that do this surgery all the time. They're well versed in it. This is a study, like, hospital where people are training and stuff like that. So this is the best place for you to be for having Cushing's and having the surgery. So that made me feel really, really good to know that I was in a place where people knew what they were doing. They do this all the time. So it's a little bit less stressful because they know what they're doing, like, it's not an experimental thing for them. This is something that they do. And those doctors up there were awesome. I had Dr. Sue, my neurosurgeon, Dr. Van Darker, my ENT. They were both awesome. I loved being in their care. I felt comfortable. They made me feel like they knew what they were doing. They made me feel like, the surgery was going to be a piece of cake for them. And although, of course, the normal, like, natural nerves were still there, I wasn't too worried about it. I didn't feel like something was going to go wrong, or, they didn't know what they were doing. I felt really good about it. And so I'm thankful that I ended up there. So I prepared myself for surgery after that. So after meeting with Dr. Sue, and him looking through my MRIs, my chart, talking to me, telling me what the surgery would be like, meeting with his team, and then a couple weeks later meeting with the ENT's team, and meeting with the ENT, talking to him, and him checking my nose to see if there would be any issues or anything that could possibly stop him from being able to do his part in the surgery. And doing all the stuff that I needed to do to prep. I guess it took a couple months to actually schedule a date and get me on the calendar. And then once that was done, I just had to prepare. So I had months to kind of do my best to mentally prepare for this thing that was happening for me. And then I also want to point out that during the time that I was going through all this and, getting ready to have this surgery, COVID hit. So right before I'm about to have the surgery, there's a major global pandemic going on that completely turned our world upside down. And I still have to go into a hospital and have brain surgery. So it was very, very nerve-wracking for me to not only have brain surgery, but now there's a deadly virus going on. I don't know, how that's going to affect me. And there's a possibility at this point that nobody's going to be allowed in the hospital with me because they weren't letting people in the hospital at all. So now it's like I have to have this life-changing surgery, and I have to do it by myself because nobody can be in there with me. So it was very, it was a lot. And I think the way that I handled it was kind of just to ignore it until I couldn't ignore it anymore. Obviously, I knew it was happening. I was aware. I let, the people in my life that I really cared about know what was going on. And it was a part of my life, but I did not spend a lot of time dwelling on it. I just avoided it because it was just easier that way. And up until the point where it was, almost time to have surgery is when I actually started to, okay, this is happening. Like, I'm about to have brain surgery. I'm scared. I'm stressed. I'm nervous. I don't know what's going to happen. I don't know what this looks like. And then, my family is also stressed out because they don't know what's going to happen to me. And but they're also trying not to have me take on their stress because I'm the one that's having brain surgery. So it was just a hard time for everybody. It was crazy. Like, I was worried about people, that didn't live in our house being in the house with us. I was worried about contracting COVID. I just was really, it was a lot. So we're, at this point, I'm having my surgery on May 5th. The pandemic started sometime in March. So, less than 2 months of being in this crazy COVID pandemic. And then I have to have brain surgery. So it was a lot going on. It was a lot going on. And the day before the surgery, I had to go up to Irvine to get my CT scan, my MRI, my COVID test, and make sure that I didn't have any issues leading up to the surgery, and then make sure that they knew exactly where the tumor was so that they could just get to the tumor, get it, and then, there was no complications. So we did have to go up a day earlier and stay up there. We just got a hotel and we stayed up there. And it was a lot. And in between that, before I had to go up to Irvine, I had to have MRIs and stuff and CAT scans and all that stuff. So there was a lot of preparation in between. But leading up to the day, those are the 3 things that I had to do. And then just getting prepared for the morning of, I don't remember what time the surgery was. I'm pretty sure it was in the morning. So I had to go there, and my mom and my dad and my sister dropped me off at the hospital because they were the ones that came up and stayed. And it was very emotional to say my quote unquote goodbyes to them, knowing that nobody would be able to come in there with me. My mom at least was able to wait in the waiting room with me until they called me back into, the surgery prep. So once they called me back, she had to go, and that was really hard because then it was like, dang, now I really am alone. I don't have anybody here with me. And I should also point out, this is my first time ever having surgery, so I don't know what to expect in that regard at all either, because I never had surgery before. So it was my first big hospital stay since I was born, pretty much. And I had to do it alone, and it was tough. So luckily the lady, the nurse that took me back to the surgery prep room was really nice. She understood, how hard it must be for me to not be able to have anybody in there with me, to be having the surgery, just all the things, all those feelings that are coming up on top of it being COVID, and freshly in COVID, she just made me feel really comfortable and really good. So I'm really grateful for that. I went back, I changed into my, surgery outfit, called my family, chilled for a little bit, took a pre-surgery picture, and then they wheeled me back. They gave me the anesthesia, and all I remember is them counting down and then waking up. So a lot of people say that, when you get the anesthesia, you just remember hearing them count down, and then the next thing you know, you're waking up and you've already had surgery. And that's exactly what happened to me. I just remember waking up in the recovery room, and there's people around me, and I heard them on the phone with my mom, letting them know that I had woken up, and all that different stuff, because that everything was just done by phone at this time because they couldn't be in there with me. So yeah, that happened. They woke me up. I sat there for a little bit. Then I went to my recovery room, which was, for this surgery, they put you in the ICU just because of the type of surgery that you have. So I had to be in the ICU floor for a night just to make sure that I recovered properly, everything was okay, because it is a brain surgery, and it's very can have a lot of really dangerous effects if it's not done right, or complications. Anything can happen with your brain. Your brain is so important. So I had to go on the ICU for a night. I remember, this is the crazy thing too, I remember right after surgery I had to get another MRI so they could make sure that they got the tumor and everything looked okay. And I remember kind of being out of it a little bit, but hearing like the people that were wheeling me into the MRI, whatever, saying that the person that was in there before me had COVID. So I was like, are y'all gonna clean that out before you put me in there? Like, it was just a lot, like. So now I'm like, oh my gosh, I just had brain surgery. I don't know if I'm gonna catch COVID. I'm so scared and nervous. Like, I don't know what's gonna happen. And luckily I didn't catch COVID, so that was a good thing. Praise God, I did not catch COVID. But it was scary, It was like, this is a real thing. Like, somebody had COVID, and I'm very susceptible to it now because I've had surgery. So my body is not, as strong as it could be. And yeah. So I think this might be a good place to end this episode. I will record the rest another day, or I'll just record it and put it out another day, I should say. But I hope that you guys enjoyed this and that I didn't ramble too much, because I don't know, I feel like I do sometimes. But anyway, thank you for listening, and then come back next episode so that I can talk about the recovery process and how I am doing now. So see you guys next week. Have an amazing week.